CHARCA is about moving together with various stakeholders to empower women. After working for 3 years in 6 districts of India, let's see how this has happened from some of our champions. Durga Devi, peer educator from Kishanganj. Farida Khan, councillor from Udaipur. Puligamma, self-help group leader from Bellary. Rama Devi, President SHIP, Guntur. Dr. C. Vasant Kumar from Government Hospital, Guntur. Ceylon Thangi, Member Positive Network, Aizawl. Zampui, peer educator from Aizawl. Sabir Ahmed, peer educator from Kishanganj. Khurshid Ahmed, teacher from Udaipur. The people you were just introduced to represent the strength of the CHARCA project. We will further discover the distinctiveness and innovation of CHARCA through their stories. But it is perhaps best to state at the outset that CHARCA's distinctive contribution in its fight against HIV and AIDS lies in its focus on women's vulnerability. Women constitute more than 1/3 of India's population living with HIV/AIDS. CHARCA's strategy has been to build capacity and create local support structures for women.
CHARCA has been working over the past 3 years in 6 districts of India. It has costed $5.5 million, and it has been a program which was implemented by the United Nations. 8 UN agencies have been working together, plus the UNAIDS Secretariat, to make this program a success. And it has shown to us that whether we are WHO working for health, or ILO working for fair labor, or UNODC fighting against drugs, for all of us it was a major priority to fight the vulnerability of women.
CHARCA's vision finds concrete expression in a partnership between the government, NGOs, donors and the joint UN system. It was implemented in 6 districts across India: Bellary, Guntur, Udaipur, Kanpur, Kishanganj and Aizawl.
CHARCA has been a joint initiative of the United Nations family here in India. We've worked in, of course, in 6 districts, and we've operated through the process of lead agencies and then supporting agencies. As is appropriate, and certainly works the best when we undertake joint initiatives, each agency has brought what it does best to the issue at hand. In the case of UNFPA, for example, in Udaipur district, they had worked on reproductive health as an entry point for work on HIV and AIDS in the CHARCA program. UNDP has worked to strengthen local organizations, both positive organizations as well as others that haven't had HIV as a focus, to enable them to work better with positive people within the districts in which they had worked. UNICEF worked in terms of mothers and parent-to-child transmission. In addition to the core agencies that had specific districts to which they were assigned and in which they were responsible, we also had agencies that played a cross-cutting role that provided their perspectives and expertise to all of the districts. UNESCO, ILO, UNIFEM, and WHO played these roles.
With its focus on the innovative use of shared spaces to create interactive encounters where none existed, CHARCA has made it possible for young women to understand their bodies and their sexuality.
गांव में जब मैं HIV/AIDS के मुद्दों पर चर्चा की तो तब महिलाओं को पता चला कि HIV/AIDS
My work with the women of the community has made me realize how women face several health-related consequences due to unsafe practices by their husbands when they migrated out of the village. But through CHARCA's work, women are now able to speak freely with their husbands about their own sexual health, seek couple treatment for sexually transmitted infections or condom use, which they now understand is necessary for the well-being of their families. In the Women Information Centers that CHARCA created, women found a comfortable and safe place to access this information. I can say with pride that CHARCA has been instrumental in the process of empowering these women.
Positive network of Mizoram CHARCA appear as
Knowledge of my positive status was a source of fear. not just of the uncertainty of the future, but also of the possible discrimination and stigmatization I would face if my status was revealed. But CHARCA gave me immense strength to deal with my positive status, because as a trainer I had to go out and help other people who needed it.
CHARCA hianin meichhia te tana malakna chu ran ran kan neya abik takin kumsom pathum le.
Through the CHARCA project, the sense of isolation and discrimination from the community that drug users feel has been addressed, as CHARCA has brought together people from all walks of life to work towards its objectives. Drug users like me have been able to regain some of the lost dignity through the project. CHARCA adopted a multi-stakeholder approach, not only at the community and local level, but also at the national level, in order to mobilize positive energies to create an environment for women. Various players such as government officials, policymakers and the media were involved in this effort.
CHARCA has done pioneering work in the field of dissemination of HIV messages. They have organized excellent exhibitions. In the recent past with UNIFEM, they have helped us in developing an online resource bank for IEC, which will provide ready-made prototype materials and will be certainly very useful for all the partners. I am sure that the work done by CHARCA in the field of IEC, particularly in dissemination of HIV/AIDS messages, will be very useful in future for all those who are working in the field of HIV/AIDS.
Government bodies apart from civil society organizations, religious organizations and Panchayati Raj institutions have all been catalysts in this change. CHARCA has also used the traditional and charismatic authority of religious leaders to create awareness on the issues of sexual health and HIV and AIDS.
HIV जैसे मुद्दे हमारे समाज में आ रहे हैं, फिर उन लोगों ने
In a society where religion has a stronghold over people's lives and talking about sexual health is taboo, we felt that religious leaders are important figures. If we convince them about the CHARCA message and the need to generate awareness about HIV and AIDS and related issues, they could be effective messengers for the community. CHARCA was successful in this strategy. Maulvis and Pandits spoke about the issues after the regular prayers at the mosques and temples. There was a growing acceptance within the community about the needs to address these issues.
ग्राम सभा के अंदर काम करने वाले सभी सरपंच, वार्ड पंच.
CHARCA has involved and sensitized key functionaries from within the village, including the Anganwadi workers, ANMs and Panchayati Raj institutions, who were then responsible for spreading the message on HIV and women's vulnerability in the community. More than 2 decades into the epidemic in India, CHARCA is a significant model that offers many lessons and achievements to take into future programming in our fight against HIV and AIDS in India.